Hi guys, welcome back to my channel. This is the second video to a two-part video where the first one I explained my first code experience, and this is the second part where I explain mistakes to avoid in your first code. I'm just gonna take this off because it's just gonna get in the way. I have written down 14 mistakes to avoid during your first code experience, and hopefully mistakes that you just continue to avoid in any code. Mistake number one to avoid: do not take on more responsibility than you know that you can handle. Here in Ontario, where I am licensed to practice as a nurse, we have something called a 3-factor framework where it's the right patient for the right nurse in the right environment. For example, an RN should not be passing off an acute, unstable patient to an inexperienced, brand new RPN or LPN, depending where you are. For anyone asking you to cover their patients while they run off the floor for a pee break, for lunch break, whatever the situation is, and you cannot handle your current patient assignment, don't bite off more than you can chew. I know that. Make sure that you take on a mini report for any patients that you are covering for a nurse. Make sure that you get the code status of the patient. Know why that patient is there. How do they ambulate? Do they need any medications for the time period that the nurse is going to be off the unit or on break, whatever the situation is. Just get a mini report, a mini status update on the patient that you are covering. There is nothing worse than having an actual code situation and you know absolutely nothing about the patient that you are responsible for ultimately. Read the entire picture of the patient. It's often said in nursing that you're not just looking at the lab work or vital signs of the patient, you need to look at the entire picture of them. How are they presenting physically to you? How are you objectively viewing signs and symptoms of a patient for whatever situation that it is? And maybe subjectively, what is the patient telling you? Just because a vital sign shows that a patient looks stable or appears stable doesn't always mean that something is fine. So always look at the entire picture of the patient and be able to pick up on those signs when things are going south. Remain calm. I know that's very much easier said than done, but remain calm and in a timely manner, make sure that you ask for help. Don't try and be a hero. Don't try and do everything on your own. Nursing and in a hospital setting, it is a team effort. It is a medical team for a reason. People need to work together. Get help in any way that you can, whether that means pushing a code blue call button above the headboard of the patient, if that means that you're physically yelling out into the hall for help, if that's the only way that you can do that. Avoid trying to do that if you don't have to, because then it like raises alarm to other patients on the unit as well. But obviously if it's like an absolute emergency and there's no other way that you can get a hold of somebody, then yell out for help. Get out objects that don't need to be in the room. Bedside tables, extra chairs, pillows on the floor, bags on the floor. Get things out of the way. If that means you need to remove a patient from a room, like a second patient, get them out of the room. I have been in code situations where I physically had to move an entire patient connected to 2 feeds out of the room, roll them into the hallway, make sure that they're secure in the hallway, just so the whole code team can come in and we can do our job properly. Some hospital rooms are just very poorly designed and there's already very minimal space. And so you just want to maximize that space as much as possible. That way you can fit as many bodies in that you need to that are on the medical team, and the equipment that's going to be used to help resuscitate that person. Obviously safely as well. Don't just go throwing things into the hallway so it's making it unsafe for other medical staff or patients. Just clear head. Just think calmly, clear head. Know what's inside of your crash cart if that's the team that you work on. Know what's inside of the airway box if that's what you guys use. Obviously make sure that all the equipment that you need inside of your crash cart or your airway box is there and accounted for. You honestly should be doing like daily or weekly checks to make sure that everything is accounted for in the box. That way in an emergency situation, you're not scrambling looking for things that should already be in there. Ensure that the patient is on a flat surface. I have witnessed a nurse starting to do compressions on the bed. And while it's great that they were doing compressions right away, it is no use to anybody if there's not a flat, solid surface behind that patient. Some places, like if you're in a retirement home and you don't have access to one of the backboards, you can physically take off the headboard of some of the beds and place that underneath the patient and do chest compressions on that. But no matter what, you need to have a backboard, some type of flat surface behind the patient to ensure that you're doing proper chest compressions. Balancing a body on a bed is absolutely useless for anybody, and it's a waste of time and energy, honestly. So ensure that you're doing chest compressions properly. Here on YouTube, Dr. Mike consistently stresses this on his channel. Chest compression, chest compression, chest compressions. It's because it's real, it's true. do them properly, start them immediately. Make sure that you have the proper form. You're gonna have your hands like this, not bent. I'm just showing like this. Get that motion going, and you want to make sure that your arms are extended out. Don't have a bent elbow with you. Make sure they're extended out and you're putting the right depth into that patient. So make sure you know how to do CPR. I know sometimes when there's code situations on, some medical staff just like to come into the room and just watch what's happening. You're not helping and you're kind of just spectating. Get out of the room and go do something else with another patient. If there's already enough bodies in the room and everyone is already assigned to a certain task, if you don't have a specific role designated for you during that code, do not spectate, get out of the room, go help with other patients. There's still other patients, obviously. For the nurse that is specifically in the situation where the code is being run, help them out with their meds for their other patients. There's nothing worse than being in a code and having to come back to not only charting, the stress of everything that just happened, and then also having to play catch up with all the patients that you miss medications on. Help out your fellow nurses. This is something that has personally happened to me before. If you wear glasses, ensure that they are secured to your face, or just take them off if you can do fine without them if you're the one doing the chest compressions, because I have also been in a code situation where my glasses have fallen off onto the patient. It kind of just sucks. It gets things in the way. It's distracting. The main thing you just want to focus on is making sure that you're doing proper chest compressions at the right depth, the right speed. Now I know there's a heightened awareness about PPE, but pandemic aside, when you're able to, once your whole team has arrived and you guys are able to start getting in the flow of things, put on a isolation gown, just get your PPE on that you need to have. I've been in situations where there's been a bowel obstruction and feces have actually come out of the intubation tube. Blood may come out of the intubation tube. If something else goes wrong, there's a multitude of different reasons for why things like that would happen. And to just protect yourself, just wear the proper PPE. For sure, have some gloves on, okay? For sure, put some gloves on at a minimum. Obviously, the patient comes first and like we're gonna deal with that first, but you also need to protect yourself and ensure that you don't end up with bodily fluids sprayed all over you for whatever reason. I know some facilities are a little bit more lax than others with their footwear policies, but make sure that you have running shoes on, something with a closed toe. Yes, I said closed toe, and something preferably that doesn't have like a mesh on the top of the shoe. This again just has to do with leakage of bodily fluids, and this is not just for like a code situation, just in general for a hospital. You don't want the possibility of anything leaking out onto your foot, and you want to be able to run if something is necessary. You don't want to lose your grip on anything. So know what your hospital policy says about family involvement with the code. Obviously, the family is going to dictate a little bit or play a role into if the patient is a DNR, if they're full code, what measures they want to take, if they want to be intubated or not. They obviously play a role in that sense. What I mean though, is the family physically going to be in the room while the code is being run, or are they going to be removed from the room and outside of the room? And there's science that shows the benefits of both. I've been in a code situation where I was on top of the patient doing the chest compressions, and the family member walked in. They seen just the chaos of what goes on in a code, and they let out the most shrill scream that I have ever heard in my life as I was on top of this patient. And I will never forget that moment in my life. It broke my heart. I'm gonna like tear up about it right now, actually, just thinking about it. But it broke my heart in that moment for this person to walk in and just see the chaos and what was going on in the room. Obviously, as medical professionals, we know everything that needs to be done to save this person, but as an outside viewer, it's a lot to take in, right? I've also heard on the other side of things with other science that it's actually very beneficial for family to be in the room watching everything that you're doing, so the family knows that the medical team has done everything that they possibly can. Read the situation with the family, if they can handle it or not, what the hospital policy says, things like that. You know, they kind of go hand in hand there. Debrief when you're done with a code situation, especially if it's your first code or if it's your first few codes. Codes in general can be very traumatic, especially if they didn't turn out well or if things went wrong. In my case, for example, with the family member that walked in and let out that scream, like it was clearly, it has had an impact on me still. It's a good thing to debrief, and not only is debriefing an opportunity for you to reflect on everything that happened with the code or things leading up to the code, but you can do some personal reflection on room for improvement for yourself, for your medical team as a whole, or even just for your facility or organization as a whole. Things can always be improved, and so debriefing and breaking things down is a very good opportunity to just get things off people's chests and kind of see room for improvement going forward, or even things that you you did well, because sometimes you do everything well and everything by the book and to the algorithm, and things still don't turn out, or they do turn out great. Don't ever feel ashamed or like you shouldn't talk about what just happened. It's okay to talk about what just happened. It's okay. At the end of the day, nursing is a field where it is lifelong learning, and we all have scary firsts as a nurse, but as long as you can look back on your own practice to see things that you can improve for yourself or improve as a team or facility, then you're headed in the right direction. So I hope these tips help out anyone who may have just experienced their first code or who hasn't started their nursing career yet. Hopefully you can be a little bit more prepared for your first code. Subscribe and make sure you also watch the first part of this video where I just talk about my first code experience. Thanks so much for watching. Bye.